All right. Okay, I am Dr. Mary. My actual name is Mehrnaz, and the reason why I called Mary was because it was easy and also my mom's name, so it's not too far, you know. But I also like the name. I work at the University of Alabama in Huntsville. I am one of the people that work for OPT. My main role is to do research, and I do some training in the safety area. I do research in the safety area, and also I am working on this that I'm going to tell you about. I'm very excited about this, and I hope you guys enjoy. So, other than that, I mean, is there anything else that I'm missing? No, that's me. Okay. All right. So today's topic is going to be a little different, okay? We have talked about the safety issues in the past, and we've talked about the trainings that we have throughout the state. And this time, I'm going to talk to you about the use of Social Vulnerability Index for investigating transit deserts in the state of Alabama, okay? I'm going to start with telling you what social vulnerability means, and then telling you about Social Vulnerability Index, and then I'm going to move to transit desert, and then telling you where transit deserts are in our state. All right, what is social vulnerability? Social vulnerability is basically refers to the socioeconomic and demographic factors that affects the resilience of communities. Okay, what does it mean? Let's consider COVID-19. Quickly after COVID-19, we realized that older people, older population, are more likely to be basically be hit by this, lose their life over this. So they were the socially vulnerable population as far as COVID-19 was concerned. So in any outbreak or any emergency situation, there is going to be a population that is going to need our help more. This is going to be related to transit later, so it's not always emergency cases, but I'm going to explain that as I go. Social Vulnerability Index is a quantitative scale for us to basically better understand our community needs. So what are the most vulnerable population, and how can we support them? Not just throughout emergency situations, but it was created based on the emergency situations and outbreaks, okay? Now, CDC is using this in the last decade. They've been using the SVI, Social Vulnerability Index, and I'm going to tell you, excuse me, I'm going to tell you how they used it now. So how CDC is using SVI in helping the society. CDC is using the Social Vulnerability Index for allocating the emergency funds, emergency preparedness money. They also are using the SVI, Social Vulnerability Index, for allocating food and shelter and medicine to those groups of people that will need it more likely need it than others. Bedding, medicine, water. Also, they use this Social Vulnerability Index to help assist communities, like with, let's say, shelters, okay, emergency shelters. Not only we know that we need shelters, but we need to understand, where do we need them? Where should I send this money? I have this emergency funding that has been, created by the government, and I receive it. Now I have this money. How should I spend it? So the other way they're using this is to how many emergency personnel society would need, like a portion of the society would need. Also, identify areas that need the emergency shelters. In a case of an emergency evacuation, they use SVI, Social Vulnerability Index, for identifying how they can evacuate people especially people that are older, that have disability, that don't know English, that they're the vulnerable population. And also the last but not least is the best way. They use SVI to help communities to basically find the best way to the population to recover from like a disaster or an outbreak. Okay, because like let's say COVID-19 made many people lose their jobs. Now, how am I gonna use the money that we have to make people get back on their feet? And that's how CDC is using SVI. Now let's talk about Social Vulnerability Index for transit. How are we going to use this for transit? Basically by using variables that from US Census Bureau and ACS to identify the most vulnerable population as far as transit needs are concerned. Okay, so that the people that will need our support and need to get places but they do not have a mode of transportation, they have to rely on us. And that's why we can use this. This is a quantitative, basically, measure that will help us identify those portions of our community that will need our help. Like people that are in poverty, people who have disability, people who are older. Now that we talked about the social vulnerability and social vulnerability index concept, let's talk about transit desert. What is transit desert? Transit desert is where you have a huge amount of transit needs, for different reasons, and you don't get enough services. So basically you have a lot of demand and you don't have a lot of supply. I mean, think about the concept of desert. Desert is where you don't have a lot of water. So there is the land, but there's not enough water for the land, right? So that's a desert. So transit desert is where basically we do not have enough services for the population. Transit desert comes from the food desert concept. Okay, so this is not a new thing, but it's actually pretty new. It's the last maybe 20 years that they started studying this. Transit deserts are usually created or more emphasized where we have poor bike rides, poor bike lanes. We don't have sidewalks, and we don't have proper road infrastructure. So they're more emphasized. Those are where we actually we as our agencies come into play to help people out in the transit deserts. Think about this. A person is living somewhere, right? For having a job, they need transportation to get to where they need to get to. So transit deserts will not allow people to take jobs. So let's say that I took a job that is 25 minutes away. Can I take that job knowing that I do not have a way to get there? I don't have a car. There's no transportation mode for me. There's none of your services available. There's no public transportation, fixed routes, nothing. How can I get that job? That's going to affect my well-being. That's going to affect my life. Now let's think about a health problem. Let's say that I need dialysis every 2 weeks to survive, to live. Now I don't have anybody to take me, and there is no fixed route, there's no buses, there's nothing that can take me. So my life is dependent on that. So transit deserts is going to affect people's well-beings in the society. So in our study, I can't call it pilot study because we are a little further than pilot study, but basically we picked these 5 most important variables as far as social vulnerability for transit is concerned. I actually want to take a minute to thank our regional managers. I know that you have received a lot of surveys from me, and I appreciate your patience. And I want to thank them for working with me. We are a team in this together. And I appreciate them for just being there and just doing what needed to be done. But just going over some of these variables, age over 65. So old age is definitely one of the contributing factors. When people get older, they may not be able to drive for several reasons. And those are the percentage of population that will need our help, okay? So the percentage of the population age 65 and over is one of our variables. The second one is vehicle ownership. This is kind of like a very, I can say, more obvious one, because if you do not have a car, then you need somebody to take you places, okay? So vehicle ownership is within our vulnerability variables. The third one is disability. If someone is disabled, either cognitive or physical disability, they may not be able to drive and take themselves places, so they need somebody else to do so. So that is why we picked this variable and put it in our model. Crowded housing. I actually want to thank Chandra for this. After having several meetings with Chandra, she mentioned something interesting. She was like, you know, for over many years of her experience, she has seen people that live in crowded housing, which means that, for instance, let's say there are 5 kids and 2 parents, and there's only 2 cars. And if that family has to take care of their mom and dad, which grandparents will come and be added to that, there'll be 9 people with 2 cars. So she mentioned that she sees a lot of people that, you know, live in crowded housing and use services, the transit services, and that is why we added this. So the percentage of households with more than 1 occupants per room is the variable we chose. The last one is poverty, percentage of households below poverty threshold. So people with poverty are more likely to need transit services, right? They're less likely to own a car or have a good, reliable car that they can take them places every day. So that's why they may need a transit service. So this is the model. It's like a multi-dimensional statistical model. I'm not going to get into it too much, but this is how it was calculated. But I'm more interested in telling you of what it's standing for. So how does all of our 67 counties in the state of Alabama look like as far as SVI for poverty, SVI for old age, SVI for disability, SVI for vehicle ownership, and SVI for crowded housing? How does it look like? I actually made, calculated this and made maps for you to be able to visually see where these areas are. All right, so looking at social vulnerability index for poverty in the state, you can see that it's not quite the south, but there's like a central to the southern area of Alabama that is suffering from this vulnerability. The county names that you see on the board here, they are the most vulnerable ones. So the maps that you will see from here on are going to be color-coded. So the red, the darker red you have, the more vulnerable in that category they are. Okay, so the more green they are, the least vulnerability. So we're good. Okay, so when it's red, it's where we have to kind of put our focus in. So these are the counties that are red. Okay, I'm gonna name a few in each category. Dallas County, Perry County, Greene County, Sumter, Clark County, Pike County. These are the counties that are suffering from this type of vulnerability. Looking at old age, it's no longer concentrated in the southern and like central area. You see it's actually, you know, scattered throughout our state, okay? So you see Randolph County, Henry County, Lamar County, Winston County are one of those very vulnerable counties. Now, if you don't see, if it's like an orange one, there's still vulnerability here. but it's not as vulnerable as this one, as the rest of the state, as the rest of the counties. The next one, okay, so old age was scattered around, okay? Disability. Disability, it's interesting that it is actually very much concentrated in the western areas of Alabama. We have disability. So, I mean, the rest of Alabama is not looking, obviously, the best of best, but when you get to the darker red, that means that you're really suffering from it. So, I mean, just to name a few, Fayette County, Greene County, remember, Greene is showing up in different categories of vulnerability, and that is telling us something. Social Vulnerability Index for no vehicle ownership. Now, let me tell you this. We also have crowded housing, remember? But a crowded housing means that, for instance, there's 2 vehicles for a household of, there's 2 vehicles in the household of like 9 people. I told you like 5 kids, 2 parents, 2 grandparents. There's 9 people, right? So when you look at vehicle ownership though, even though there's not a lot of dark red in this. I mean, there's like, major vulnerabilities, but there's not an extreme vulnerability in this because every household is gonna have 1 car, ish. But there are counties, 3 counties that are showing up in the dark orange are, I'm never gonna wear this again, I swear. I haven't done the proper training for this. Franklin County, Chambers County, and Lee County are within the counties that are vulnerable for no vehicle ownership, okay? Say that again?
Well, Lee County's college town.
Right, but no vehicle ownership, well, college town means that we need to still take people, college students, to where they need to get to. So if it is a college town, then there's all the reasons to have such transit for people. Yes? That is true. That is true. So this is, okay, let me clarify something. I can see how you're kind of questioning, guys, what is happening? What am I doing? Seriously. Can I hold the microphone instead? Hey guys, all right, I hope that doesn't happen again. So I was gonna clarify this. This is only the demand. We're not talking about the areas that we have already serviced. Like, I understand you're saying, okay, Lee County. We have service in Lee County. Why is it showing red? Because I am just purely looking at the demand. We aren't looking at the supply yet, okay? And I'll tell you that in the future research, we're gonna look at the supply. But before we can look at the supply and then finally understand what is going on, we need to look at the demand. And these are the variables that is causing the demand for transit. I mean, is that clear though? Okay, all right, good. So, no vehicle ownership, we talked about. So crowded housing, we see kind of the same areas in the west and not quite the south, but we see that in the central to the south areas of Alabama, we have crowded housing problems. And Macon County, Monroe, Wilcox, Greene shows up again. Notice, like, that's an interesting thing. Like, it keeps showing up in different vulnerability categories. All right, so before I move on to explain what this is about, I want to tell you that US Census Bureau has data in different resolutions, okay? So the biggest one is county, and the smallest one is group level, block group level. So this one is tract level, which is in the middle of those, okay? So I just like pulled a few counties to kind of show you what these counties look like, okay? Just to kind of see what we can do later with it. All right, so age over 65. You can see that as far as old age is concerned, we see vulnerabilities in these pockets here. The orange is standing for the major vulnerability, but we have, but the majority of the mid part is low vulnerability to average vulnerability as far as old age is concerned. But when you go to the north area, you see that it is actually suffering from a major vulnerability as far as old age is concerned. When you move to disability, looking at it as far as disability is concerned, that northern area is darker red, you see? So they are suffering from, there's a lot of people with disability in that area. There's also this belt here that you can see that also is dark red. As far as poverty, guys, look, poverty, Baldwin County is not suffering that much, right? I mean, there are a few areas that we are seeing, like a little bit pockets here and there, and there's like average poverty, average level of vulnerability for poverty, so that's not our issue. You know, when we look at this looks pretty good. But when we look at the total social vulnerability index, we see that there is a need for transit for Baldwin County. Now, going back to your point, does that mean that we have addressed these needs for disabled people, for poverty? Yes, we already have transit in the state. But this is like how the demand looks like. All right, moving on to, I have like two more counties. All right, as far as Coleman County. Okay, Coleman is not suffering much from old age. You see, the old age is like average vulnerability. I mean, we have some moderate vulnerability, but it's not a very, very old county. But when we get to disability, we see that is showing up as a problem, especially in the northeast areas and the pocket in the middle. Now, moving on to poverty, there's not a lot of poverty issues in Coleman, okay? So that's not a huge amount of concern for us. But when we look at the total SVI, we see that there is a need for transit in Coleman County. Looking at Macon County, let me see. Macon County, woo! This is your county, right? All right. Yeah, I was telling him yesterday that, show up tomorrow morning. I want to show you your county and how it looks like. This is how it is, All right, age over 65, Macon County, it is a rather old county. So there is like, as far as old age is concerned, we are seeing vulnerability in the county. As far as disability is concerned, we are seeing a huge vulnerability in the county. Is that what you have experienced too? Okay, so this is like, this is lining up. Why? Because people have filled out these forms for Census Bureau, and that's where this data is coming from. ACS is also kind of the same thing. So moving on to poverty. Poverty is also kind of an issue, but we still have some pockets in Macon County that are not suffering from poverty. But overall, we are seeing a huge demand for transit as far as Macon County is concerned. All right, so what is next? Next is understanding a serviceability index. So creating another quantify or quantitative way of looking at this, to see how much service do we give people. Because we have we have agencies that are currently working, so we have services, transit services. So looking at the number, the locations, the exact locations of your agencies, number of employees of your agencies, number of vehicles, and maybe miles of service is going to be in our serviceability index, okay? So remember, transit desert is created when we have a lot of demand, which I showed you. Macon County had a lot of demand, right? But when it came to serviceability, we don't have a way of looking at it right now, okay? We are trying now, like with this new system, hopefully it's going to be in place. We're going to have a better view of, you know, how many vehicles every county has, and, you know, kind of like an updated list. I mean, I already have a list, but, you know, for not doing it over and over again, we need to kind of have a finalized, you know, vehicle inventory list, personnel number, like estimations and all that, so that we can create the serviceability index. Yes.
With in some areas they're more rural, like Green, Macon, Wilcox, compared to a Huntsville or a Montgomery, where you have a pocket of people in one area where there's a lot, and then you take a rural county and they may have to go 15 or 20 miles to pick up someone to take them somewhere. So there's always going to be a greater need in the rural area because you don't have as many resources. And then when you can go, and everything pretty much that we do is kind of a demand response type thing in a rural area, because you're not going to have a lot of fixed route stuff because it's just spread out too far apart. So, you know, you're going to always have more disparities in a rural area than you're going to have in an urban area or something like that, you know. Like Bobby, he has Demopolis, and it's kind of a cluster of people there, but you go to Greene County and then it gets a little more rural, and, you know, we put a lot more wear and tear on vehicles, which causes a lot more maintenance, a lot more fuel costs, and so, you know, a lot of times when we're doing reports in NTD and they asking a lot of questions about, you know, why so much difference between vehicle service hours and actual client hours that you have. And that's the reason why, because it's just so far to go to pick someone up, you know. I got some areas that in Wilcox County that just bringing somebody back from dialysis, just going to pick them up is like 40 miles just to go pick them up. And then just that much time they'll sit, you know, they'll do the dialysis. There's three days a week, 4 hours a day, and then that individual has to be taken home. You know, it's just different. It's different with rural America. Yes.
Thank you so much for that. And I love this. You know why? Because we are in this together, and I want to get a feedback from you. But I want to answering your question, he's basically saying, because like Wilcox County, because in that county, or let's say Macon County, people, it takes 40 miles to go pick up somebody. Okay, so is that fair to look at the, you know, the mileage? But we're going to look at the number of passengers. We're going to look at the density of the county, as well as all the things I mentioned before: number of employees, number of vehicles, number of mileage. Obviously, a person that is the director for a county that is more rural is having to deal with maintenance a lot more, because there's a lot of infrastructure issues that we have in those counties. When you have to drive basically 40 miles on a average quality road, of course you're going to have to pay that much more for maintenance later on down the road. You know, you have to pay more for tires and changing them more often and paying more for gas and having more mileage. So this is gonna be, this is great, guys. Like that's why we're, you know, that's why I'm talking about this in front of you guys. You know, that's why this is just the beginning, because now that you know what we're doing, now I can use your help, use your comments like this to make sure that we do it right. Okay, so I appreciate comments like this, and that is why we have a survey, but I'm gonna tell you what's next, and we're gonna get to the survey. So talking about basically identifying and targeting the needs of 67 counties in the state, and then making a guide to working with our agencies, with our drivers, with our providers. Why is this research so important? Why is it so important to be done now? Because we need to give guidance to our providers to target their audience. We need to target the certain areas, as well as providing specific needs to that specific population, portion of the population. Let's say Baldwin County, as an example. Baldwin County had some disability in the corner, so we need to kind of, you know, make sure that with maybe that limited budget that we have for marketing, use that limited marketing budget towards those counties that are suffering from that specific vulnerability. Okay, so like let's say Baldwin County again, looking at Baldwin County not suffering from poverty, in the marketing, I'm not gonna use, hey, a fare is gonna be $2, come use our services. I'm gonna be like, you have disability, you're old, come use our services so we can raise the number of our passengers and riders. That's gonna help. So basically, in general, having a better balance between supply and demand. What is the ultimate need, guys? What is the ultimate benefit? Not needs, but ultimate benefit. Having the best possible transit system in the state of Alabama for our people. Listen, we are in this together. From the people of authority to providers, researchers, drivers, we're all in this together. We all want to give the best services. Even with the resources we do have, we all know that we can do a little bit better. So how can we do better? And who knows what to do? Okay, so I'm not talking about future money. I'm just saying with money we do have right now, we can improve. And we all know we can improve. We know that there is something that can be done about this. We just can't put our finger on it. And that is why you are going to help me today with my research. I will need your help, regardless of if you've been in this business for 3 months or over 30 years. Your opinion matters to me because you are the ones who are dealing with this firsthand, right? So that is why you have a survey in front of you. And I'm gonna, I actually have it in here. I was gonna point out something. There's like a typo here. So, all right. So we're gonna answer this. I want everybody to take a pen and write their agency name and their own position on that piece of paper. If you are an ALDOT member or a person that is not a provider, it's okay. Just put where you work at. You don't have to use your name. You have gotten a survey like this before from me, but trust me, this is having all the variables that we could even think of. So this is, I dug in and found many literature about transportation and transit, and this is what came from this. Now I need your opinion to see how relevant each of these are throughout all these years of experience you have, or what is the gut feeling? What do you think about this, you know? All right, so the first one, everyone wrote their names? Everybody has the survey I'm talking about? Awesome. Thank you, guys. All right, write your agency name, write your position. First question, What is the level of relevance of population below poverty when it comes to the need for a public transportation? Are people in the social category more likely to use your services? That's the typo I was talking about. So just don't mind it. It's been copied and already out. I didn't want to waste paper, so. So do you think if a population is below poverty, do you think that is relevant as far as their need for transit? And how relevant? Okay, so we have 4 different levels of relevance. One is A is not at all relevant, B is slightly relevant, C is fairly relevant, and D is very relevant. All right, moving on to the second one. Move on. Second question. What is the level of relevance of unemployment when it comes to the need for public transportation? Are people in the social category more likely to use your services? All right, 3. Everybody got it down? So what you think, what you have seen, again, doesn't matter if you don't have a lot of experiences, just put your answer down. I need your help. 3, what is the level of relevance of population with no high school diploma when it comes to the need for a public transportation? Are people in this social category more likely to use your services? All right, number 4. What is the level of relevance of population with disability? Do you think that's relevant, guys? People with disability need your services? Yes, they do. But how relevant do you think it is? All right, number 5. What is the level of relevance of single-parent household with kids younger than 18? Do you think that is relevant? A single mom that has little kids before college, would they need your services more? Is that relevant at all? You can always say not at all. That's fine. But just give me your opinion. Okay, number 6. Being a minority, is that relevant to transit? Like, do you think people in the minority will need your transit services? Some people are shaking their head yes. If that's what you're thinking, put it down. This is going to be incredible for us in the future. All right, number 7. What is the level of relevance of population speaks English less than well? Do people that not have the ability to speak English well would need our services? I mean, I can explain, for instance, a scenario would be I don't know English well to get a driver's license, to have a car, to get places where I need to get to. So that's why I would need a transit system. Number 8. Everybody's answering this. Guys, I'm gonna need your help. All right. Number 8. What is the level of relevance of population living in mobile homes? I've heard it from a lot of people that is one of the more important variables. Are you filling this out? Yes. Are you also filling it out? You? No? Yeah. Do you have? You are filling it out? Okay. Oh, you already completed. Oh my gosh. All right. So, all right, population living in crowded housing. Like I said, we've done a research that it showed that is a vulnerability, but do you think people in crowded housing will need our services more? Number 10, population with no vehicle available. Is that relevant? And how relevant? Population age 65 and older. Do you see them using your services a lot more? All right. Population living in apartment complex or senior living centers. Do they need your services more? Population with disability, non-institutionalized. So basically they're living at home, they have disability. Are they more likely? Yeah, I think so. Is it relevant? All right, so the last question is like, I want you to take a minute. If I've missed anything that you have seen, that people in your county use services because of this certain reason, that you haven't seen in the questionnaire already, please put your comments down. If you have any comments like we had before, please put it down, because I'm going to read this very carefully. I am going to encounter this in our future research, and I'm going to update you in our next meeting. I hope you have enjoyed. Thank you so much. Like always, I want to thank all of you for the services you give us. I mean, I don't see myself being able to do what you do, but God bless you all. Thank you.